not even really supposed to be sitting like this because I'm using my abdominal muscles, but I've seen a lot of people do their post-op on their full hysterectomies, partials, whatever they had done, and mine is very different, in a good way and in a bad way. So I have not taken a shower just yet. I have been sponge bathing because our tub step is pretty high up. So my hair is greasy, but I still have to brush it, braid it, and get after it. So I am officially 8 days post-op. I am filming this. Now, you guys, if you've seen my YouTube video of the surgery, you could tell how much I was crying, how much I was out of it, how much pain I was in. So here are some pictures of the incision sites. If you don't want to see that, skip 10 or 15 seconds. Here are what they were a few days ago. And then, before we get into the matting, again, I'm not supposed to be doing this, but I feel okay, so yeah. So this is what they're looking like now. Here's this one. Doesn't look as bad. The belly button is not as bruised as it was. And then I have this one, which got way smaller, and that one. So obviously looking a lot better. Now, the first night was absolutely horrid. I don't remember coming through, and typically when I'm under anesthesia, I always remember coming through before they take you into your actual room. They take you in the recovery room. I always remember that. I have no recollection of that at all. I do remember waking up and having no control of my bladder. Now, that's for a few reasons. One is the doctors say your bladder is the last thing to wake up. And two, at first we thought there was some damage to my bladder, but then I have interstitial cystitis and a bunch of other chronic pain illnesses. What I remember waking up on the potty, and I remember the doctor looking at me, and my boyfriend and my mom were sitting across from me, and I'm like peeing, and I've got the doctor, the nurse, my mom, my boyfriend, everybody's kind of staring at me while I'm just sitting there. It sounded like a water faucet, like I just could not physically stop it. And I remember my boyfriend's never given me weird looks, and he's looking at me and he's like this. And I'm just like, what? Like, you guys are the ones watching me go to the bathroom. And I remember the doctor asking, what is your pain level? And mine's always been a 5 or a 6. And then we found out that, I have that one endometriosis spot on my kidney line. I'm not sure exactly what it's called. It's the line that attaches to my kidney. But I remember them asking me what my pain level was. And I'm typically a 5 or 6. And I say 8, 9, 10. It's 10, it's 10, it's 10. And then I just started bawling. And they're like, okay, you need to stand up. We're going to help you get to the bed, which was luckily only like a step. And then they were going to help me lift up my leg and get into bed. And I didn't feel safe to get up because I couldn't stop going to the bathroom. They're like, oh, you have a diaper on, it's fine. And I'm just like, in your head, you're thinking, I'm not supposed to stand when I'm peeing. Like, this is not natural. And literally the one step, they put a fresh diaper on me, pulled it up as I stood because that's how bad it was. I could not even stop just to stand up. And by the time they laid me down and got I don't know exactly what they're called, but by the time they got the cuffs on your legs that improve circulation, the diaper was full and it was leaking already. And so that was horrible. It was like that the first 5 or 6 hours. They kept doing bladder scans. They kept telling me I was retaining, so they did a catheter. And let me tell you, when you're awake, this is the second catheter I received awake. It hurts really, really, really bad. So my pain has been really weird. Like I said, it was a 10 for sure when I woke up from surgery, as it should have been. Like, they tore out my insides. So they gave me ibuprofen, they gave me Vicodin for home. But what I didn't really care for was, even if I wasn't in pain, they were keeping me on the pain medicine, but I was so out of it, I couldn't really speak out for myself. Definitely should have talked to my doctor about having an advocate there. I don't feel like I was being drugged. I think they were just trying to keep it under control because I said it was a 10, because it was definitely a 10. But they were giving me 2 oxys, and normally 1 Vicodin kicks my butt. They were giving me 2 oxys along with Tramadol in an IV. So I had one nurse giving me 2 oxys, while the other nurse is right here putting in Tramadol in my IV. And then after I took the 2 oxy and they were done with that, Nordicaine or Norbicaine, or I don't know, it was these little white pills, little yellow pills, I don't remember. And so they were giving me 3 different types of pain medicine at once. And if you count the shot and then you count each pill, they were giving me 5 things at once for the pain. Now, I'm happy they were trying to help me keep my pain, like, down. But I don't like the feeling of being all drugged up when I'm not having issues. Everybody told me you're gonna want, I don't remember what it was called. It's something that they use after you give birth or a C-section so you don't use your abdominal muscles. My hair is so, I gotta wash it tomorrow. I was told I was gonna need that because sitting and standing was gonna hurt. Which, yeah, it hurt the first day or 2. And I slept in the recliner up until yesterday, so day 7. And my problem with the recliner and the bed is I sleep on my stomach. I'm just a stomach sleeper. That's how I get comfortable. And so when you've had everything ripped out of your gut and your insides, you're not supposed to lay on it. And that's the only way I can get comfortable. So I was finally able, they told me in my hospital video that I posted, sleep in the recliner, but as soon as you can tolerate it, go back to your bed. Now, the main reason they didn't want me on the bed for a little while was it's on the ground for my older dog. So, obviously using a lot of muscle to get up and down, clear on the ground, right? I see so many people needing ice packs, heat packs, weighted blankets. That stuff's never worked for me. My boyfriend, again, it's in my other video, got me this heating pad that straps around your waist. You don't have to hold it. It's got a massager on it and everything. And I thought for sure that was going to help because it helped with my period cramps. It did not help at all. I wanted it off the second I put it on, even on the lowest setting, even with the massager off. Ice never helps. So I've been just kind of winging it. I do what I can. I've been walking a half a block a day because I'm used to being out with my horses. I'm used to taking my border collie out and doing things with her. I'm used to driving long distances. And so sitting home 24/7 for 8 days is driving me nuts. And so I got up, and the gas station's about a block away. And I'm like, I want a hot coffee. I'm going to walk to the gas station. And my boyfriend went with me. He opened the doors because I didn't even think about that. He's like, are you going to be able to open the doors? And I'm like, I didn't even think about how heavy the doors were there. And I'm not just going to walk up to a stranger and be like, yo, my insides just got ripped out. Open this door for me, right? Like, not going to be like that. I walked to the gas station and back with him, and I was feeling great. And then I start thinking I can groom our dog, who has, like, some severe trauma from her past owners with grooming. Trying to hold her, and I'm not supposed to lift anything over 10, 15 pounds, and she's clearly, like, 15 pounds, and I don't know. I am able to go all day, and then at night I feel it. So I'm pushing myself way too much. I need to take a step back. I wouldn't say it's been completely, a pain-free surgery by any means. But it hasn't been as bad as that night in the hospital, knock on wood, because obviously I still have a lot of recovery to go through. I'm getting to where I'm restless. I'm sitting in the chair at night just twitching, like, and it's just because I'm used to getting up and doing stuff. And people say, oh, you're lazy, you sit home all day. My body does not. I might stay home, but that doesn't mean I'm just sitting here all day, right? Like, I have animals to take care of. My boyfriend, luckily, only works about a mile away, so he comes home and feeds the dogs, because I cannot physically bend down and scoop up all the dog food out of the bottom of the container and all that. So he comes home a couple hours after he leaves and feeds. But I have not yet, knock on wood, had a hot flash. My doctor goes, as soon as you feel a hot flash, I want you to put on your estrogen patch and start your hormones, because you're going to be in menopause, you're going to have fragile bones, you're going to have hot flashes, memory loss, sleep issues, itching issues, weight gain. Like, you're going to have a lot of problems. So the patch is pretty much just to keep some hormones in my body, so that it's kind of like I'm halfway into menopause, is the best way I know how to explain it. So I'm not like fully 100% 28 years old, bam, menopause, right? The only thing I've really had an issue with is I feel like I'm on my period. Like, my cramps feel like a period pain. And that's the other thing. Everybody's like, you're going to need pads, you're going to need diapers, you're going to bleed a lot. When they did my surgery, I bled maybe, if you take like the lightest tampon and just cover the tip of it, like, that's how much I bled. And I have not bled since. And when they put the catheter in, I bled, and the nurses were really concerned. And my doctor's like, I don't see why they are concerned with that. You just had major surgery, had a catheter in the entire surgery, had the catheter pulled, your bladder is retaining, you had another catheter put in, you cannot control your bladder. Yeah, there's going to be a little bit of blood. And it was literally a few drops. Like, they made it like it was this big deal, like that I was bleeding so much, and then it was like literally a few drops. I don't know. Everybody has a different recovery. I've seen some girls in severe pain, some girls like me where you're kind of okay, you know, you're uncomfortable, your pain's at a 5 or 6, but we're kind of used to that, which is really horrible to say. I just don't like the feeling like I'm on my period, because I feel like I need to go to the restroom and clean up and take care of that. And I keep feeling, this is a little more personal, I keep feeling like I'm having discharge, but I'm not. Like, I feel like I'm sitting here having discharge, and I'll go to the bathroom and there's nothing. I'll wipe, I'll clean, everything. There's nothing. Now, next Thursday, I have a call appointment with my doctor. So I'm going to speak with her about those things. Obviously, if it was urgent, I could call her now, but I don't feel like this is urgent. I don't know, I expected a lot worse. Also, what was really horrible was the last second, I decided I didn't want to do it. I was like, the recovery is going to be painful, I don't want to do this, I'll just try another birth control. Even though I tried a couple of pill birth controls, I had tried a patch birth control, I had tried a shot birth control, nothing seemed to be helping me. And I got so scared of the recovery process seeing some of these videos. And right as I said, hey, you know, I don't think I can do this, right as I looked up to say, hey, the doctor said, okay, we'll see you later. And I went to say, no, and I was out. Now, that's not their fault. They had already administered the medication way before that. It just took a little bit to kick in. And, do I regret doing it? No. I regret the recovery time, because I do not like sitting home doing nothing 24/7, especially 8 days in a row. It absolutely drives me nuts. So, that's about the only thing that is driving me nuts right now is I can't go see my horses. Well, I can go see my horses, but it's just a lot getting in and out of the vehicles and things like that. My parents and my family are taking care of my horses. My boyfriend is pretty much taking care of the animals here. He cooks everything for me, cleans everything, like, he's doing everything, because I'll get up and he's like, what are you doing? Go sit back down, you're healing. And everybody's telling me, relax, just let it. And it's just, I can't. I have restless leg syndrome already, especially when I'm sleeping. And then you add not being able to get up and move much and do much, and it's just, I don't like it. I don't like it at all. So, I don't know. That's kind of how my 8-day post-op is going. Like, I'm really, really tired. When I slept in the chair, I thought I was actually pretty comfortable and getting a lot of sleep. And then sleeping in bed last night, I slept over half the day away. That's why my clock's turned. Because I slept over half the day away today. Because I'm just like, oh my god, I can finally sleep on a mattress. I can stretch out. I can move. And I feel like that's going to be my next few days, is catching up on sleep. I still have some pain medicine left. I do need to call and refill one. I'm still taking the antibiotics. I still have an appointment with a GI doctor because, again, they did find out that my colon is swollen and that they don't know what is going on. And with my laparoscopy for the endo, the first one, it hurt for like a week and I was good. But this one, yeah, this one's kicking my butt. It's not as painful as I thought it was going to be. It's not as bad as I thought it was going to be, but it's enough to keep me down. So, ice packs aren't helping. Can't get comfortable. I hate weighted blankets. I can't. Everyone's like, oh, get a weighted blanket. Get one of those C-section wrap things that make it to where you don't use your muscles because it won't hurt as bad. Anything weighted like that stays on me 24/7 like that, I can't do it. I'm supposed to wear knee braces when I ride my horses, and I cannot do it. I just don't like things being strapped on and staying on. Don't like it. Can't do it. So that's kind of how it's going. It's painful, but it's not as bad as it was. I'm able to get up and down off the bed, actually fairly easily, knock on wood. But that's my post-op update. If you guys have any questions, I really am not secretive. You guys can ask anything personal or not personal. We will see you in the next video.